I'm CHANTELLE. I'm an enrolled nurse and I'm undertaking the 2020 graduate program with mental health at Latrobe Regional Hospital. I always wanted to be a nurse ever since high school, and I decided to enroll in the studies when I was a cleaner with Latrobe Regional Hospital, and over the last 2 years or so I've been studying, and recently about 4 months into my graduate program. The staff are always there continuously with clinical supervision and ongoing mentoring, and there's never anyone on the ward that you can't ask for help, and I really suggest the program.
I'm Kate Hopner and I'm the Executive Director of Mental Health and Chief Mental Health Nurse at Latrobe Regional Hospital. Thanks for showing your interest in our graduate program for 2021. You've just heard from CHANTELLE, and with an amazing story around how she's made a career in mental health, and there's so many career opportunities available for everyone in our service. We run 10 sites across Gippsland, over to Orbost, Yarram, Sale and Bairnsdale in the east, through to Traralgon in the Latrobe Valley, and Warragul and Wonthaggi in the west. We've got a whole range of graduate rotations in different clinical specialties all across the region, both inpatient and community, and everyone has an opportunity to experience not just the mental health program, but working in a rural and remote setting. So we really look forward to receiving your applications and hope that you'll join us for our graduate program next year.
Hi, I'm Jackie Dieter. I'm the Graduate Coordinator at Latrobe Regional Hospital for the Mental Health Graduate Program. I've worked for LRH as a nurse for 28 years, originally starting at Hobson's Park as an EN. LRH has been very supportive to me with my career. They supported me through my Bachelor of Nursing as well as my grad dip. I'm currently working in our education team. A little bit about our program. Our program is a 2-year program that's open to RNs, ENs and allied health. The first year involves portfolio work, and that portfolio work credits the RNs towards their graduate diploma in the second year, which is expected that they enrol in. Our program now allows for our graduates to specialise in areas that they choose to specialise in, including our 2 acute inpatient units, the geriatric as well as the acute adult, our ACES team, which is our acute crisis intervention service, which is our triage and ED clinicians and our community clinicians. We have a perinatal program, we have the Agnes unit, which is a mother and baby unit, and we have our various community teams. Our grads are employed on a 2-year contract with an EFT of 0.8. Initially they start off with 2 weeks orientation, and then they have 8 study days throughout the year, and each grad is allocated a clinical nurse educator and a clinical nurse supervisor. Grads get 4 weeks leave in the first year, and it is expected that our RNs enrol in a graduate diploma in the second year. Mental health grads are really well supported by our education team, and the graduates now have an opportunity to specialise in areas that they choose to, or they can choose to do rotations through various areas. LRH is very supportive with career development and offer ongoing clinical support.
My name is Aaron. I'm a social worker and I've been doing the grad program for about 1.5 years now. I think the thing that appeals to me most about this program was just the opportunity to work in complex mental health in a clinical setting. It's a fairly unique opportunity, which is why I decided to move down here from Melbourne. So I'm working at the moment in the Child and Youth department, though I've had opportunity to work in the hospital as well. You get a lot of time to just work on your confidence and skills and independence, and at the moment I'm working in a team that's really supportive and has a lot of experience, which is really great. I think if you're allied health and you're looking to work in mental health, this is a really good foundation. It's a good kind of head start and it's a pretty unique opportunity that you probably wouldn't get in many other places, so I definitely recommend it.
I'm KAYLA and I'm one of the 2020 mental health grad nurses with LRH. I decided that I wanted to be a grad psych nurse during my mental health placement on the inpatient ward. I like all aspects of mental health. I'm currently working at CRCU. It's a 14-unit area through Latrobe Regional Hospital that patients come after they've been in Flynn in the inpatient unit, and it's mainly all with psychosocial rehab and trying to rehabilitate them into the community before they actually live independently. The staff at CRCU have been absolutely amazing. They're always willing to share their knowledge and help us whenever we've needed it. I've always felt really relaxed and comfortable. If I've ever had any issues or anything, they're really approachable and always help us.
Hi, I'm Michael, one of the clinical nurse educators for Latrobe Regional Hospital. Within the 20 years of working here, seen a really strong development within our graduates program that's on offer between the general program, collaborative program and mental health programs. 20 years ago was a real commitment that I made to come and working for LRH. It's certainly something that I don't regret. I've managed to take on many different opportunities career-wise. I've been offered a lot of support. We've engaged the service to have a real commitment to clinical supervision, and also in my role I've been offered the opportunity to work as unit manager within our aged care mental health program, opportunities throughout the community-based mental health and also within the inpatient bed-based services. So really look forward to you guys coming on board, and as an educator I'm sure I'll be able to share some of my knowledge and experiences with you, so welcome.
Hi, my name's REECE. I'm a social worker in the 2019 graduate program at Latrobe Regional Hospital. I'm currently working the adult community mental health recovery team based in Traralgon, and since day one I feel like I've been at home here. Everyone's been super supportive, especially for a team that never gets graduates. What really drew me to the role though was getting to work in a clinical mental health setting, and it's lured me from interstate, so I guess that's a good thing. The support that you get from the education department as well, especially during your grad year, meeting up with the other grads and the educators on a regular basis, and if you've got any questions they're always there to be found as well. It's really made this transition into the working life quite comfortable.
Hello, my name's Anna and I'm part of the 2019 Mental Health Graduate Program. I'm in the second year of this graduate program and currently enrolled in the Melbourne Uni Postgraduate Diploma. I was attracted to Latrobe Regional Hospital because I had a lot of support. I was working here as a Division 2 nurse as well. I currently work in the ACES team, which is the Acute Community Intervention Service, and that covers 3 areas. So that is the emergency department, the triage, and also working in the community.
My name's Jess. I'm the Nurse Unit Manager of the Agnes unit, which is more commonly known as the Mother-Baby unit here at Latrobe Regional Hospital. I began my career at Latrobe Regional Hospital about 7 years ago and have worked in a range of different areas, including the adult mental health ward, the community teams called the ACES team, as well as the ED and triage clinician, before transitioning into perinatal and infant mental health in the perinatal emotional health program, and now as a manager of the unit. I guess what really attracted me to mental health at Latrobe Regional Hospital is the diverse range of specialties that you can work in, and as well as being able to provide some care to some of our most vulnerable people in the community. Here on the Agnes unit, we provide a really supportive and caring environment to mothers who are struggling to transition into parenthood. They may be struggling with mental health issues themselves, or just finding it a bit difficult to build that relationship and bond with their baby. I guess a graduate year at LRH is highly supportive environment with great career opportunities and huge diverse range of specialties. And I hope one day we can see you here on the Agnes unit.